Amarillo, and welcome back into the chat on Newsday Amarillo and News Channel 10-2. I am Alan Robertson.
Good morning, everybody. I'm Rhonda Lahnert.
And I ain't silly. I'm straight from Philly. Chuckalicious, Chuck Williams.
I like it. Obviously, with where we are in today's landscape, I mean, in this digital age and all the things under the sun, of course, artificial intelligence, AI. You know, we've seen it in some crazy cases, but in this case, with this next guest on, AI can be used for a multitude of benefits, especially when it comes to the world of healthcare. We are joined today by Dr. Bob Murry, Chief Medical Officer at NextGen Healthcare. Talk to us a little bit about the world of AI and the connection that it has with healthcare. So, Dr. Murry, thank you so much for joining us this morning.
Yeah, thanks for having me. I think, AI is doing all kinds of things in healthcare, but the thing that I'm most excited about, want to talk about with you today, is what it could do for regular physicians seeing patients regularly in their offices. And I think a lot of your audience may have had the experience where they go to the doctor, they want to talk about stuff, and the doctor is just staring at the computer or typing during the visit, right? And you're like, oh, is he listening to me or is she hearing me? And that's not good. And I'm a practicing family physician. I can tell you that is not what the doctor wants to be doing. So what we at NextGen Healthcare are bringing to physician offices across the country is what is called ambient listening. It's AI powered. And your doctor's visit's going to be different. You're going to go, the doctor is going to say, hey, I'm going to use my phone and speech recognition to help me write this note. Is that okay? And you're like, yeah, sure. And so then the doctor doesn't really look at the computer, is looking at you, interacting, figuring out what's going on, what's the plan, how are you going to feel better? And then when that is done, but in real time, just a few seconds, artificial intelligence will turn that conversation into the note that the doctor used to have to spend all that computer time creating. So the physician, the healthcare provider thinks it's great because they're able to do what they really want to do, which is talk with you as a patient to take care of you. And you as the patient also get the benefit of not needing to fight the computer for the doctor's attention. And you also hear everything out loud that becomes, the start of that note. So it's really kind of a win-win.
Well, a lot of people, they're not really sure about AI, and some people are kind of slightly scared of it, even so. But how are people reacting to this new development and what it does for them in their visit? What's the vibe that you're getting from patients?
Yeah, well, we're actually asking patients, and they think it's great. So, but to back up, I think there are a lot of maybe worrisome uses of AI or some scary things that we hear about AI. But that doesn't mean that all artificial intelligence is bad, right? And this one we think is a slam dunk because it helps the provider get through all of the computer work that they would need to do, meaning that they don't have to spend hours after their day seeing patients is done, and it helps them pay attention to the patient. And the way that we at NextGen have implemented it, nothing is stored, right? We're not training the AI. It's not sitting in some big data bank. It's just used immediately in real time to do this task that really helps the provider and then helps you as a patient. So this one is a good use of AI.
So by rights, I should have no concerns about my privacy one way or the other, considering that this is using the AI platform then.
Yeah, I think you're always right to be concerned with privacy with AI. I mean, again, the way that NextGen Healthcare has implemented it, nothing is stored. But, your physician may be using something else. And so as a patient, you're always free to ask, right? What are you doing? How can I be assured that this will stay private? And the provider ought to be able to answer those questions. And if not, somebody in their practice needs to, because you want to make sure that you're able to, really be honest with your healthcare provider and not be worried about, what's going to happen to that, that conversation later. But the way that this is done, the way that we're doing it, you should not be worried.
Absolutely. I mean, pardon me. And when it comes to the doctor-patient relationship, obviously, privacy is a huge thing, and with the sentiments that were just shared. But one of the bigger things with that, from your expertise and your colleagues and things of that nature, efficiency. That's one of the bigger takeaways having with this is making things a little bit more concise, making things a little bit more timely, different things of that nature. Talk to us a little bit more about just how important it is to tighten up with the efficiency sides of things from a doctor's perspective.
Sure. I mean, I am a practicing family physician. I've been using this technology for about a year, and I think it's terrific. So it lets me interact with the patient in the exam room, not interact with the computer. Most people don't realize this, but a lot of doctors spend hours after they're done seeing patients doing all that computer work. And with this technology, it cuts a lot of that out because the conversation is turned into the note. And then the doctor, has time back, right? And they could either use that to make themselves more available to see more patients, or there's a big problem with physician healthcare provider burnout in this country. And maybe this just gets them home on time. They can spend time with their family or doing something they enjoy, and they don't feel the need to back away from patient care because this big kind of administrative burden that is producing the document is greatly alleviated. And so we're seeing this in practice as we're rolling this out to physicians and providers across the country in all different specialties. But we're very helpful that it's going to make an impact. I think it will. I think, again, there's lots of experimental uses of AI, iffy stuff, but this one I think is a slam dunk.
Okay, I'm a little nervous about AI personally, and we already addressed the issue of secrecy, etc. But all right, I'm coming into you. What am I expecting, especially with the ambient listening and other AI tools that you might have around there? What can I expect from this whole episode?
Yeah, well, what we're hopeful would be if you notice anything at all, you're just noticing that the doctor isn't staring at the computer, that they're actually paying attention to you. So again, when I see patients, I will say, hey, I'm going to use my smartphone and speech recognition to help me write my note. Is that okay? I have not had a single patient say no. But then from then on, it's just you're getting better and more attentive healthcare from your physician because they're not distracted with the need to capture all of the details about, how long this has been going on and when did it start and all this stuff. All of that is just kind of becomes part of the note. Interestingly, the AI, I like to hear about my patients' families and their children and all kinds of stuff. It doesn't capture any of that because it knows that that's not medically relevant. It's just the medical details of the visit that are turned into the notes. And so it's helpful in that way as well.
Absolutely. Yeah, I have a little bit of time before we get out of here. Thank you so much, Doctor, joining us this morning. But when you spoke about the feedback that you've gotten so far, obviously speaking with the patients and obviously when it comes to doctors, moving across the country, of course, just in your perspective, just how soon do you think this can be implemented with most, if not all, of doctors' offices across the country?
It's a great question. The technology is ready to go now, and we are pushing hard to try to get it into the hands of providers because I do think that it is going to make a big difference for them. We're also needing to teach the doctors kind of what to expect, how to use it, what it's good at, what it's not good at. And, many physicians, many healthcare providers are creatures of habit. So it's not the technology that's going to hold back the adoption. It's the willingness of providers to adopt it. And so for all of your audience who are patients, right, if the next time the doctor is looking at the computer, instead of paying attention to you, maybe they'll say something like, wow, you're using the computer a lot. I've heard that there's some new stuff out there that can help with that. See what they say. I mean, many times our best ideas as physicians actually come from feedback from our patients, and so most physicians will respond well to that.
Absolutely. Definitely be an interesting thing to see as we move forward, of course. But Dr. Murry, thank you so much for joining us this morning. You have a great and safe rest of your day, sir.
You too. Thanks for having me.
Absolutely. Thank you so much.
Thank you.
Couple of seconds before we get out, just want to say thank you to everyone listening in. Tuning in. Thank you to you guys, the amazing co-host that you guys have been. And it's been a fun time. Absolutely. So as always, stay blessed, stay loved, of course. I will be gone getting my extra hours of sleep. But David Lovejoy will be back tomorrow morning. Stay blessed. We'll see you tomorrow on The Chat on Newsday Amarillo.